right, there's a new study that suggests a popular pill that's used to treat COVID could create mutations that will then spread it to other people. Here to talk about this, Dr. Todd Ellerin, the Vice Chair of Medicine at South Shore Health. Good to see you, Doctor.
Well, Doctor,
good to see you.
Good to see you. That seems to throw up a red flag. So let's talk about this pill. One, what is it called? And two, when do you prescribe it to a patient?
The name doesn't roll off the tongue, Eddie. It's Molnupiravir or Lagrev. So I do prescribe this to patients, but it's few and far between. See, Paxlovid, which is the antiviral we're more familiar with, has been shown to decrease hospitalizations and deaths in patients when compared to placebo. Molnupiravir, unfortunately, in their registrational trial, didn't show any decrease in hospitalizations or death. It did decrease viral load, which is important, and so it's few and far between.
So, Doctor, this medication is specifically designed to trigger mutations in COVID-19 that will weaken or destroy the virus. So what's the concern here?
That's right, Maria. Let's face it, COVID mutates on its own. It does that so well. This drug has been designed to insert these what we call lethal mutations, which drives the virus down. But sometimes the virus can still survive and then potentially be passed forward. So the real question is the risk-benefit ratio. So these investigators from the UK looked at about 500 samples, and they saw a Molnupiravir molecular fingerprint in 500 out of 1 million samples. So most of people don't have this. But the question is it better to give a patient Molnupiravir if you can't give Paxlovid, if you can't give remdesivir, the other antiviral? Is it better to give them that and lead to some propagation of mutations? Remember, you're driving the virus down. Or is it better to not give it to them and just allow the viral load to maintain at high levels for longer periods of time? Both may lead to mutations. So that's the big question.
Right. Dr. T, so you're leading nicely into the next question. So we have several options right now to treat COVID patients. So will this drug continue to be one of them?
Right. So Paxlovid and remdesivir are our two go-to medications. But in the occasional case where patients can't tolerate that, I do think that I will still give this in the future on rare occasions. And why? Because remember, we are seeing this Molnupiravir mutational footprint globally, but it's still rare. And let's face it, all of the deltas and omicrons and these subvariants we're seeing now, none of them have that mutation. So it doesn't seem to have generated a mutation pattern that will spread widely. So I do think we'll still use it for a while. It will be few and far between. I'm not worried. If you're a patient that has received it, don't worry. But we really choose those patients carefully, and we don't give it to pregnant women. That's important.
All right, Dr. Todd Ellerin, thank you, doctor. We appreciate it.
Take care.
Take care.